The goal of the best practices training is to train your entire staff, your doctors, your receptionists, and your technicians. And it's not about clinical training. It's not about actually doing the procedure. It's about everybody gaining an understanding of the importance of oral health care. Traditional continuing education programs, as far as dentistry goes, I'm a veterinarian, I go to a weekend course. I'm a technician, I go to a weekend course. I'm one doctor or one technician in my practice. I come back to my practice, it's maybe a 2 or 3 or 10 doctor practice. And I try to change the world of veterinary dentistry in my practice, but I'm just one person. So one of the key things that we did was to say, we've got to train everybody on staff. You have to train the doctors and the technicians and the receptionists. Why do I have to train the receptionists? Well, who answers the most questions in your practice? It's not the doctors and it's not the technicians, it's the receptionists. They're the ones that greet your clients. They're the ones that talk to your clients when they come in to pick up their pets after dentistry procedures. They need to know. What's our standard of care? What goes on behind those closed doors in the back part of our hospital? And if I asked you how many of your receptionists have actually watched you do a dentistry procedure start to finish, what's your answer? Probably none. Well, then how do you expect them to be able to communicate with your clients in the front part of the hospital? They need to know what's going on. So you can't just train a doctor or a technician. You have to train all your doctors, all your technicians, all your receptionists, so that then you can work together to create a standard of care. We need to train the entire staff. That means we're going to ask you to close your hospital. Most doctors are pretty hesitant to close their hospital to train staff for a whole day. But when we do that, what we do is we create this energy and this enthusiasm amongst everybody on your staff. And now all of a sudden, everybody on your staff knows the importance of oral health care. We finished that day of training with a brainstorming session, and during that brainstorming session, we ask everybody on your staff to give us ideas about how we can change your standard of care in your hospital and what's important. And what may be important to the receptionist may not be important to the doctor. So we get that input from all the staff members to help us create goals to then create our standard of care for dentistry in our practice. So having the whole staff in the room at the same time is totally worth closing your doors, because you're going to get that return on investment every single day in your practice for as long as you own that practice.